Advancing Healthcare Awards, or AHA Awards 2023 in around the category regarding the award for innovation in healthcare science. A nomination had been put forward on behalf of the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for kids. The nomination asked several questions. There were several sort of questions in and around the nomination. The first question was in this category in around the award for innovation in healthcare science. The award for innovation in healthcare science. Summarize your project and its significance. So, the RPSG, or the Renal Patient Support Group, the RPSG and the Kidney Disease and Renal Support Group, or KDARs for kids, are both evidence-based support platforms for pediatric and adult renal recipients in chronic kidney disease (CKD). The platforms have expanded internationally as the go-to place evidencing science across kidney care, public health, and research practice. The second question: describe the project more fully, including any relevant background work and supporting evidence. Both initiatives have focused on efforts surrounding and integrating healthcare and education. Retrospectively, both social media platforms have been implementing and following academic practices of those colleagues and peers to ensure rigor throughout kidney care practice. The RPSG and KDARs have progressed, and there have been publications, to substantiate according to pediatric and adult nephrology aligned to public health. The RPSG and KDARs initiatives have several evidence-based publications and website highlighting how different areas of science and nephrology and public health are amalgamated. Both the RPSG and KDARs were developed to ensure there is awareness surrounding kidney care. In linking patient and public involvement, or PPI, and educational initiatives, both the RPSG and KDARs extend its courtesy, inviting collaborations from undergraduate to postgraduate candidates to those across healthcare and industry. The RPSG invites researchers to co-develop CKD research and get involved. The RPSG is that place where awareness and research meet. The RPSG has over 10,000 members internationally and channels across 6 social media platforms. KDARs has near 2,000 members and has represented across various arenas, including International Pediatric Nephrology Association and the American Society of Nephrology. The next question in this nomination was how does this or could this benefit patient care? So to ensure evidence-based and benefit to patients, both the RPSG and KDARs have ensured there is several social media platforms, or there are several social media platforms that are used to integrate care for patients or service users, and a premise surrounding involving health professionals and academics to partner to involve lives around kidney care. Both the RPSG and KDARs have led patient and public involvement efforts in keeping with the National Institute for Healthcare Research, or NIHR, to support practice excellence across kidney care, ensuring patient-reported outcome measures support patient care. The next question in this, in around this nomination, in around the award for innovation in healthcare science was what systems and policies are in place to sustain the achievement to sustain this achievement. Both the RPSG and KDARs have been implementing commitment to patient care over the last decade. The initiatives surrounding the NIHR standards, and according to service provision, where the NHS and kidney care practices are involved. Both RPSG and KDARs have been part of a solution to establish healthcare educational support remotely and across social media platforms. The patient public involvement mechanism, or the PPI mechanism, is important for inducing measurable quality of healthcare by allowing service users to share lived experiences to inform shared decision making. The systems and policies implemented have made both KDARs and RPSG the systems and policies implemented have made both KDARs and RPSG sustainable. The final sort of question in this nomination around the award for innovation in healthcare science is how could the approach be sort of utilized by other organizations? So the NIHR Patient and Public Involvement Framework, or PPI framework, has had a positive impact on service users. They've become more empowered, valued, listened, and more positive about lived experiences. Involvement allows more joined-up thinking between academia and healthcare to drive evidence-based healthcare. Both KDARs and RPSG have enhanced kidney care practices where scientific practices have also substantiated evidence base. The RPSG and KDARs have highlighted highlighted examples of initiatives that can be utilized or duplicated or replicated by other organizations and across healthcare. Both the RPSG and KDARs, like the NHS, ensure representation across ethnicity, race, diversity, and inclusivity to reflect scientific practice and commitment to patient care. This closes this overview in around the Advancing Healthcare Awards nomination overview in around the award for innovation in healthcare science.